When it comes to healthcare and medicine, there has been tremendous advancement, be it in regards to medical equipment, the treatment processes themselves, and the service extended to patients. Most certainly, there has been never-ending innovation and development with the aim of treating patients in the most efficient way possible. And it is at this very hospital that another significant step will be taken to declare its readiness in all aspects in becoming the medical hub of Asia. Let's find out more interesting information and facts about Samitivej International Children's Hospital in this special report. Samitivej Hospital has established a reputation for over 36 years as being an excellent healthcare facility catering to children. From the accumulation of experience and readiness in all regards, today the hospital is ready to take another significant step to elevate the standard of patient health care and service to that of an internationally accepted level under the name of Samitivej International Children's Hospital. Our outstanding strength is the ability to transfer critically ill patients, both newborns and children, via professional medical ground and air transportation services. This has been very successful, and we can boast that we have served 150 cases covering a distance of millions of kilometers. Apart from our quality transportation service, Samitivej International Children's Hospital employs over 150 doctors with years of experience and expertise to treat various illnesses and conditions, be it emergency cases or specific operational procedures. And here's another guarantee that will bring you confidence in our services. Samitivej International Children's Hospital is the first hospital outside the United States to have been granted the Clinical Care Program certification for childhood asthma by the JCI. The attention and care we deliver to our young patients starts right at the very beginning, at birth. And this is the patient room for babies from 1 to 28 days old. Let's find out more from the pediatricians, the main highlights and concerns in treating a patient so young.
Samitivej International Children's Hospital has provided care to newborns with critical conditions after birth for years. This is the proof of our expertise in the extremely low birth weight infant care. And so we also are experienced in providing care to preterm baby born as early as 23 weeks and as light as 520 grams.
We found some cases of full-term baby that have pulmonary hypertension. These cases necessitated special equipment such as high-frequency ventilator or HFOV and administration of nitric oxide gas for severe cases to lower the mortality rate.
Apart from caring for newborns, here at Samitivej International Children's Hospital, we have a two-step approach for treating babies 28 days and older. We now find out the highlights of the Pediatric Intensive Care Unit and how it caters to the toddlers and older children. Doctor, can you please tell us the highlights?
Yes. At Samitivej, our Pediatric Intensive Care Unit can have a potential to provide highest level of care for the very sick children, including the critical conditions. We can provide the care for the patient with heart disease, even open heart surgery or the closed heart surgery. We also have the equipment that can provide the high standard of care for the patient with the heart failure or lung failure. We call it the ECMO. It's from extracorporeal membrane oxygenators. In the case of the patient with myocarditis, the virus infect the heart and can cause the heart to be fail. It may take maybe 5 to 7 days. We have the time for that. We use the ECMO to save to buy the time.
For young children, matters concerning the digestive system should not be overlooked, especially diagnostic and treatment equipment and facilities used especially for babies and younger children. Let's find out more from our expert.
Yeah, one of the medical excellences of the Samitivej International Children's Hospital is the Pediatric Liver and GI Center. We can provide the treatment of the digestive diseases and highlighting with the pediatric digestive endoscopy, which cover both diagnosis and treatment. Our expertise also includes emergency treatment for the critically ill children, such as with the severe stomach pain, the bleeding from the upper and the lower intestine, and also with the foreign body swallowing, and so on. With the percutaneous endoscopic gastrostomy, so-called the PEG, we can place the feeding tube through the stomach using the endoscopy, so then we can allow the food passing through the stomach.
This hospital is very medically advanced. Doctors can offer many different quality treatment options for the many diseases out there. For example, thalassemia. With the advancement in medical technology, treating thalassemia is a lot more efficient. Here at Samitivej International Children's Hospital, we have a team of experienced doctors with expertise in this field.
Only way that we can perform the bone marrow transplant is mean that we have to get the stem cell from the donor, and the only chance of the donor is from sibling, which is brother or sister, and the chance of matching is only 25%. In the past 2 or 3 years, we have a good news. I mean that we can perform the transplant, which is a new technique we call the haploidentical transplant. So we can get the stem cell from father or mother, which it couldn't be done in the past because father or mother have HLA is not matching, it's only half or 50%. Which is success in thalassemia, leukemia, or every kind of disease. And we get the chance of cure by bone marrow transplant with this technique, haploidentical transplant, is almost 90 to 100%.
Apart from the expertise offered in specialized areas, the leadership qualities in modern medical technology in treating patients, we also pay extra attention to the special needs child. Doctor, could you kindly give us more information?
Yes, thank you. Nowadays, we found that the incidence of the special needs child is growing every year, but I feel so impressed that there is a higher surveillance among parents and teachers. They are the first group to notice that their children may delay development. They will bring their children to hospital for doctor consultation as soon as possible. Then, teacher, doctor, and parents can cooperate to provide appropriate care so that they can go back to live a normal life.
Now, on behalf of the team of physicians and staff here at Samitivej International Children's Hospital, what message would you like to deliver to the patients, to the children and the parents?
Samitivej International Children's Hospital is here to provide life-saving services to children in need and also to promote child health and development. We are very proud to watch children's lives are made better through our work. As we continue to grow and develop, we hope to become part of your family.
And this is our story, the story of how this private hospital came to receive the confidence from local and expatriate patients. We value the happiness of the children under our care, and we want to paint a smile on their faces. We are ready to bring that happiness and healthiness to all, right here at Samitivej International Children's Hospital.